I got involved in the Scirocco project, I suppose, for a couple of reasons. Firstly, I was the policy sponsor for the work that we've been engaging in on the European aspect, so got involved through that. But also, I guess, through my work over many years in terms of supporting health and social care integration. So I had a real interest around how we could better facilitate integrated health and social care. So I was particularly drawn to the Scirocco project from that aspect as well. My experience of the Scirocco tool is that it is very valuable from a practical point of view. The assessment allows you to explore areas that maybe previously hadn't been, centre stage to the work. And I guess I think what I found most useful in using the Scirocco tool has been the facilitated discussions where people who've been involved in completing the tool get together, and then there's a bit of challenge and a bit of examination and further exploration as to why people have assessed various aspects the way they did, and that has been really valuable in terms of beginning to get some focus on the strengths and maybe some of the challenges that are about. The value for the Scirocco tool for Scotland is we have integration, we have legislative requirements for health and social care integration, so we have good policy. I think the challenge though is delivery, is how do we translate that policy and the ambitions of that policy into delivery. So the value for the Scirocco tool for Scotland is in supporting people at the delivery level. So I think the ability to use it within local integrated joint boards, within teams, within services, as well as bubbling up what its relevance is maybe at a regional and a national level, I think is particularly beneficial also. I would hope the tool can be used beyond the project. I think we have lots of examples where we've got some excellent projects and programmes that have short-term funding, and the risk is that once that sort of programme ceases and maybe some of the people then move on, that we often maybe lose some of the momentum. I feel confident that we have a degree of traction in Scotland with the tool, and I think it will be upon us all to ensure that we continue to facilitate its use and share the learning, because I do think it's got a use at a number of levels across a range of programmes. And again, I think it's something you can do again and again. So I think it's interesting that you assess at a point in time, but it may be you're either over optimistic around that assessment, or maybe you can then look at what real progress has been made. So I think it's got its use, beyond a one-off use, and hope people would look at how it's integrated into their local practice.
And finally, Margaret, what would you say would be your main takeaway from your involvement in the project?
My takeaway from my involvement in the project is that it is possible to translate, the policy ambitions, contextualise those to local areas, and really begin to examine in some detail what the enablers and barriers are to successful integration, with the ultimate aim of improving outcomes for citizens.